Hi, I'm Dr. Richard Greco from the Georgia Institute for Plastic Surgery. We're going to introduce you to a segment about how to age gracefully. Today you're going to meet many patients with many different stories. Some of the stories that I've seen over the years are pretty amazing.
He took a lot of years off my life, plus made me feel better about myself.
The main motivation was I just wanted to look fresh.
I wanted to do it just for myself because, I wanted to keep looking good.
The more they look at themselves in the mirror and the more they look at photographs of themselves, they don't see the old them. And they want that person to come back out again.
I ran into a friend, this woman that I was playing tennis against, and I played with again, several times. And one day she said to me, she was going to this to a school reunion, and she was getting, in shape. Because I said to her, "Oh, you've lost a lot of weight, blah blah blah." She said, "Yeah, and I'm getting, because of this reunion." And I said, "Well, what year was it, or whatever?" And she said, "Well," she told me the year, and then she said she was 72 or something. I said, "Are you kidding me?" So I'm like, "Yeah." And I said, "Who did your..." She said, "Oh yes, I've had a facelift. Didn't you know?" And I said, "No." And so I said, "Well, who did it?" And she told me it was Dr. Greco. The funny thing was, I'm like coming in here and I'm thinking, okay, I'm just going to have like a little tuck and, whatever. So when I finally got down to it, and I came with my husband, and we sat in his office together, and he said, "Well, what do you want to do?" And I said, "Well, you know what do you think I should do?" And he said, "You want me to?" And I said, "Yeah, what would you do?" And he said, "Well, the first thing I would do is your neck." And I go, "My neck?" I said, "I never even thought of my neck." I said, I just thought I needed a little lift in here." He said, "No," he said, I do your neck." And then he said, "I would do your..." And the funny thing was, one of my friends had said to me, "Have you ever had your neck done?" And this was like before the surgery, so I didn't think, but now that it's done, it's like, oh my gosh, he's so right that I needed my neck done.
I have an interesting story about a patient who she was getting ready to go to her 25th high school reunion, and she wanted to look as good as possible. She came in and she had some facial rejuvenation. She went to the reunion, and her and her girlfriends all sat there talking about A, how great she looked, but B, how this girl and that girl and this girl, all you can tell they've had facelifts. And no one could tell that my patient actually had any rejuvenation surgery. She never fessed up to it, but they all loved the way she looked, and they all could point out the bad facial rejuvenations that were done in the audience. She felt so good about the way she looked and the fact that none of her friends could tell that she had cosmetic surgery. Some people are very open about having had cosmetic surgery, and some people are very private about it. The important thing is, when you're done with surgery, you want to be able to not have to tell people, or not have people know that you've had cosmetic surgery. If you want to tell them, you tell them, but they shouldn't be able to tell by looking at you.
I have no scars. I know that they warn you always about things that could go wrong. They have to do that, but they say you can expect to ever pull your hair back in a ponytail for all the scars behind your ears, but I always wear my hair in a ponytail, so I can't say, that's true. Greco's just such a professional, and his ability to prevent the scarring is just astronomical. I mean, he is just the best. I don't have any scars that I can see at all. And they know exactly who you are. Even after 9 years, they just know who you are and how you doing. In 2 days, and no big deal, and 2 weeks later, you're out at the gym.
They're energetic, they jog, they work out, but when they look in the mirror, they just don't see the same person that they believe they really are.
You just look better, but it wasn't like I looked different. I looked the same, but just better. And I have to say, my husband really liked it.
Well, I just noticed when I come in, he'll say, "What can I do for you today?"
The first thing we do when we meet a patient who's interested in looking younger is ask them, what do they see when they look in the mirror? What bothers them? We try to evaluate those areas that are concerned to them. Oftentimes, patients will say to me, "Doctor, can you look at me and tell me how you can help me?" And we certainly can do a complete evaluation of all the areas of their facial appearance and how we potentially can improve that. But if it's not a problem to you, it's not a problem for us. We're helping you look as good as you can for the things that you perceive to be problems with the way that you look. That's when we sit down and look at their photographs, try to decide what are the things that give them that aged look, and how can we do it so that they look better, but they still look like themselves, and they don't look like they've had a facelift or a blepharoplasty or any surgery, really. Every employee knows that confidentiality is important, that great customer service is important, and we hire people who have that attitude and we train them for their positions. Because of that, most people rave about their experience at our practice. Patient education is a very vital component of plastic surgery. The first thing you have to do is find patients and make sure that they have realistic expectations, and we can discuss what it actually is possible and what is not possible. We don't want them to go through a procedure and at the end say, "Geez, I thought I was going to be X," when that's not actually a possibility. You make your reputation by who you say no to, not who you say yes to. So there are certainly patients out there that are not good candidates for plastic surgery, and we have to find those and not operate on those patients. And then once we find people who do need our help, we try to help them in their best fashion, in the safest fashion possible.
I moved to Savannah permanently in 2004. I had gotten divorced. I hope you don't mind my saying that. I got divorced. My daughter worked here briefly, maybe a year. And there's nothing worse than being old, single, and divorced. So I figured, you know what? If I'm going to be divorced and single, I'm sure as heck going to look great. So Dr. Greco has done a couple of procedures, and the last one was my facelift. I feel like $1 million, and I play tennis with his wife, Robin. And I just think he's absolutely fabulous. I trust him with everything. The whole experience of coming into this office, from the moment you pick up the phone to make the appointment until the last time the last stitch is taken out, these people, the nurses, the doctors, treat you like you are a queen. It's just amazing. They're kind, thoughtful. They do everything for you. You are their first priority. Every patient is their first priority. I was talking about this thing. We were going to this party, and it was for people that are 70. And one of the ladies said, "Well, you're not 70." And I said, "Yeah, this is my 70th year. I'm 70. And I know what they're thinking." And so she said, "Well, you don't look 70. And I said, "Well, I have good genes, but not that good." And I said, "Yeah, listen, don't think I haven't had some help." And I said, "It's all Richard Greco. Dr. Greco is my help. And he's done, he's just terrific." So I don't get embarrassed, and I don't hold back if people are amazed that I look like I look at my age. And I'm more than happy to tell them. You always want to be your best, look your best, feel your best. And that's what it means to me to come here. It's not for anybody else that I do this. It's for myself and how it makes me feel. And Dr. Greco's made me feel like $1 million. I just feel good about myself.
So the motivation for people to want to look as young as they feel is increased because of the changing demographics of society today. Today we're working till we're 67, 70 years old. People are getting married for the second and third time. They are interested in being as attractive to the other sex as they feel.
I've got a friend. He's very particular about his car. He had a car and kept it immaculate. And anything happened to it, he'd always fix it, kept it shining. But he had his teeth bad in front. And so I told my wife, I said, this fella, I said, he cares more about his car than he does his face. And I said, that's not going to be the case with me. I said, if I can have my car painted when it gets rusty and bumps on it, I said, then I care a lot more about my face than I do my car. And that's what caused me to make my decision on it. Most of the time I don't feel 75. I try to keep busy, very active. My wife, she tried to talk me out of it because she said I didn't need it. She said, you look okay like you are. But if you want to get it done, go ahead. But I really don't think you need it. Well, I picked Dr. Dreco because I did some research on him, and I saw his resume, his history. After checking him out, and I decided that he would be the one to do it and go ahead and get it done. There was a remarkable difference. The comments that I made, my relatives that I've not seen for a while, they all make comments about it, how well I look and how young I look and so forth. So I'm very pleased with it. I'd do it again.
The University of Pittsburgh, it has been for the last 25 years one of the top 3 plastic surgery programs in the country. And it creates many of the other program chairmen. And it was really my first choice of where to train. My dad was a general and thoracic surgeon, and I started operating with him when I was 12 years old. And I always thought I was going to be a cardiothoracic surgeon. And when I was in medical school, my sister actually had an operation, and she went from the most quiet introvert to the most outgoing extrovert. So I said to my dad, what happened? And he said she had a breast augmentation. And it was amazing to me that I realized that an operation can totally change the way a person perceives himself. And so I thought, well, I'm going to look into this. So when I was in medical school, I did a 1-month rotation at Stanford University out in California in plastic surgery, and I did a 1-month rotation with one of the best heart surgeons in the world at Jefferson in Philadelphia. And at the end of it, I realized that plastic surgery allows me to look at each problem and create a new solution. You have to use artistry, you have to use your knowledge and your skills to get the result you want. And so every day is a new, exciting day, and that's why I became a plastic surgeon. One of the questions people often ask is, how do I know if I need a facelift? And usually, most women can tell. But some of the telltale signs are people, when they wear turtlenecks, they have their skin at the corners of their chin and mandible hang over their turtleneck, and they don't like the way it looks. Or they say, when I lie in bed and I look at a mirror, I look the way I used to look. Well, the reason is that the skin falls back sort of very similarly to what a facelift will look like.
I'll be 75 in June, and I was never ever somebody who wanted plastic surgery. You know, I'm going to accept myself the way I am. You have to be beautiful inside. All the aphorisms, all the things that we've been told, and I really believed that I would take that path. So it was a real surprise to me when I was in the doctor's office and all of a sudden there's little lights going off that, you don't have to put up with the bags under your eyes and the wrinkles under your chin. You can improve on it. And one of the things he said to me is, your friends are not going to know I don't do the wind tunnel look. And I have friends who have that look, and I had no interest. But he promised and delivered, because people in general who know I had a facelift keep telling me that it doesn't look like you've had one. And then they will ask me if I had my hair done or something's different about you. And truly, people I haven't seen in a while, you look great. Life is going well for you, I guess. Did you get your hair done? And that's really nice to know too. I don't mind if people know I had a facelift. I had another friend who, I kind of forgot about that gal. She went to somebody else, and I talked to her at length, and she told me exactly that, what you just asked me. She said, remember, you're doing this for yourself, because you will be judged by other people. Some people will just say, well, I could never do that. I know that this is something that I wanted to do, and it's good to have that attitude because it's not easy. I had a very supportive husband. He was kind of getting a kick out of the whole thing, actually.
So why is there such an explosion of interest in facial aesthetic surgery? Well, in the 60s, when they invented Social Security, what percentage of the country lived past 65? 1%. Today, the average age that we live to is 78. And more people are living into their 80s and 90s. And not only are they living into their 80s and 90s, they're still enjoying life. They're active, they're dancing, they're playing golf. They want to enjoy life. Medicine has helped people live longer. Unfortunately, we've not found ways to make people look as young as they feel. And so people are, especially men, we used to live to about 65 or 66, and we grew to become distinguished. Now we're living into our 70s and we're getting old looking. And so there's a rejuvenation desire by these young at heart men who want to enjoy life. And so the question is, what can we do to help them? And that's what facial rejuvenation, surgery, and procedures are all about. And allowing people to enjoy the next 20 years of their life so that they could look and feel as young as they actually feel.
I met Dr. Greco about 5 years ago, and probably even longer than that. Talking to Dr. Greco, my main concern at the time was that my eyes started to droop on the sides and started to take a little bit of my sight away. And while we were talking, I felt so comfortable with him and what he was explaining to me what to expect and what the recovery time was. We started talking about something on my neck, below my eyes, above my eyes, my forehead, and we just decided to do the whole entire facelift. I started to look a little old, and I just didn't feel old on the inside. I just looked old on the outside, and I have a younger wife. She has to look at me all the time, so I want to make sure that we kind of match. It was, you should really do it, honey.
So today we're going to talk about my approach to facial rejuvenation, specifically if you need to have a facelift. So the first thing we're going to do is we're going to evaluate you in my office. We're going to take and just sort of lift with our fingers gently and let you look in front of a mirror to see if that is the look that you're trying to achieve. We're going to take some photographs of you and we're going to put it on a computer system called mirror imaging, and we're going to morph your photographs to show you what you might look like if you were to have a facelift.
My whole experience at this facility was very positive. I never felt pressured. The first thing they did, they were very smart. They put me in Dr. Greco's office, and I went in the room, and there were all these books, and I was there for about 20 minutes, and I went through all of these books, and I was amazed. In fact, one of the women I just met was in that book, and I remembered her from the picture because it was absolutely amazing what they were able to do.
Once you decide this is something that you need, we're going to talk about what it means to go through surgery. You'll come in, and the young ladies will give you some pills to make you groggy. We're going to put an IV in your arm. We're going to make you groggier. You're going to go back to the operating room after we've had an opportunity to talk about your goals again. And the operation is done under sedation. You're not actually put to sleep completely. You're not aware of what's going on, but you're actually, it's safer not to have a tube down in your throat, so you're breathing for yourself. The operation itself will take anywhere from 2 to 4 hours, depending upon what exact procedures we're going to do. When you wake up, you'll be in one of our recovery beds, and you're going to spend the night here where the nurses will take care of you for the next 24 hours.
His staff, by far, is the best. I mean, Miss Beverly is just one of the best. She's just such a caring nurse, and just all of the above. They're just all the best that you can ask.
You're going to be sitting slightly upright in order to keep the swelling down. They'll be using some cool ice compresses to keep the swelling down from your face. And the following morning, you're going to go home, and you're going to have someone help take care of you for about 1 day. You'll then come back and visit us, and we're going to take out all your drains, and then you'll just have some suture lines. Now, I won't lie to you, you will swell up, and the worst swelling is between days 3 and 5. I tell all my patients you're achy, swollen, and say, why the heck did I ever do this? But by about day 6, you're going to know why. The swelling will start coming down, your new youthful appearance will start showing. At day 5, we're going to take out your sutures in front of your ears, and all your sutures around your eyes, if you have your eyes done, will be out. Usually by day 6 or 7 with sunglasses, you can go to the grocery store. Then usually by day 10, the swelling is gone down enough that you feel comfortable enough to go out to dinner with your spouse or go back to work with a little bit of makeup on.
I was outside. I went to dinner with friends after like a week.
And by 2 weeks, you're going to be ready to go to a cocktail party. By that time, we're going to have all your sutures and staples out, and you're going to look better than you did before surgery. Now, I will tell you, over the next 4 to 6 weeks, as all the rest of the swelling goes down, you're going to look even better. And at 3 months, you look better than you do at 2 weeks because the scars will have settled down and the swelling will have been gone. And really at a year, the scars will almost become imperceptible, and that'll really be even the best time. Even without makeup, you're going to look great. So it does take time to recuperate from having a facelift. It does not hurt. If you have pain, there's something wrong. You will be swollen, it will be achy, and sometimes people are a little bit stiff or achy in the neck because we sew the muscles back to give you a really nice, smooth neck. But the operation itself, almost all my patients will tell you that it's nowhere near as bad as they thought it was going to be. So if it's something you're thinking about, you certainly can come. We'll be happy to talk to you about it. If you don't know anybody who's had a facelift, we can put you in contact with somebody who has, and they can tell you about their experience. It's important to feel very comfortable whenever you have elective surgery, and we're going to help you get there.
Beverly, who is Dr. Greco's surgical nurse, is a friend of ours. And so I knew all about this practice way before I ever came. In fact, I contemplated doing something for a number of years before I actually did. And I just felt confident coming here because Beverly had told me so much about this place and Dr. Greco, and so I felt totally comfortable with putting myself in his hands for something like this.
The benefits of going to a surgery center over the hospital, I think, are huge. Number one, our facility has 0 infection rate. Most patients are not here longer than 4 hours from beginning to end of their surgery time and their exit time. Because you're dealing with the same people over and over again and we're doing the same surgery over and over again, we're very competent. When you go to a hospital, you don't know who's going to put you to sleep. You don't know who the nurses are going to be in the room with you. We always know who that's going to be here.
I think another thing is whenever you have somebody do something on your face, you've seen a lot of surgeries that are really bad. And so you kind of wonder, well, you got to know who you're having done. And I thought with Beverly being Dr. Greco's surgical nurse, she knew what he could do. So that's why I picked this place.
One of the most common reasons people come to see me is they say, people tell me I look tired. Well, the first thing we're going to do is evaluate the area around your eyes. Sometimes it's because your brow is sagging too much. Sometimes it's because you have loose skin hanging over your eyelashes. Sometimes it's because you have a lot of puffiness to your lower eyelids. Some people say, people tell me I look like I have my bags packed and I'm ready to go. That really just means they have a lot of loose fat and puffiness to the lower eyelids. This is actually one of the easiest operations that we do. It's got the quickest recovery. I literally do some doctors on Thursday and they go back to work on Monday. The sutures come out at day 2 and 5. The recovery is very quick. It can even be done under oral sedation. You don't even need to be put to sleep.
Well, I had a problem with my eyes and exposure over the years and lost a lot of my peripheral vision. I went to the ophthalmologist and they did peripheral vision tests, and I just wanted to have that corrected. And then while I was corrected, there was just other things that were done, just tweak things or lift things up around your eye level, just so you just don't feel or look so tired. Well, Savannah's blessed with many good physicians, and I've had patients over the years that have been to, I had one, went to every single, well, I'd say every single, but at least 7 plastic surgeons in Savannah, and just told me what they thought of the process and all of that. And then you see somebody have a procedure done and say, well, who did that? And it's just like looking at artwork, it's obvious after a while whose work is really, really good. Dr. Greco just is excellent. I told her the other day, I said, guys, you can't even see your scars. That's like really, really good, because that's what people are concerned about, the scars. And then probably more important than that, when you get a result that people don't know you have plastic surgery, because people generally want that to be very private to them, and so you don't want to look like so different that it had. You just want to look better, and people can't really tell why you look better. He makes someone feel very comfortable, and I think that's important too. If you have a physician-patient relationship, you want to feel comfortable that they're going to do a good job, but that also that you're not that you'll speak with them and communicate with them. And then, of course, the process about just how it was all set up, there's no pressuring like you need this or you need that. It's more of like, this is available. So this is something you might consider, and then you consider it, and then they just take care of it.
At any time that you want to learn more about how to age gracefully, we have a website, www.aginggracefully.md. On there are a lot of before and after photographs, patient testimonials, as well as videos that we've created especially for you to talk about different areas of how we treat facial aging. We hope that this would be helpful to you. The internet is a huge source.
My first time was in 2012. In 2008, my husband was in the Savannah sugar refinery explosion, and he lived a week at the burn center in Augusta. And so he died on Valentine's Day. And so I guess for about 3.5 years, I just cried a lot. So someone had recommended Dr. Greco, and I came here and he changed my life, my eyes. Of course, when you cry, you have big bags. But he did. He took a lot of years off my life, plus made me feel better about myself. I lost over 100 pounds. So I had a lot of loose skin that he kind of fixed for me. I was able to see results immediately, like, within a couple of weeks. The first week, of course, is really rough. You're sore. But I was just, like I said, he changed my life. And it wasn't too pretty like the first week. But, there's some bruising. But, after about 2 weeks, it was like I felt like a whole different person.
So after you've watched these patient testimonials, you may say to yourself, what is the next step? The next step is to go to our website, www.aginggracefully.md. Look at the different before and after photographs. Watch some of the videos to see what exactly is our approach to the areas that bother you. If you decide you want to come visit us, remember, education is easy. Many patients come in saying they think they need to have a complete facelift. They think we're going to do their brows, their eyes, their nose, their neck. And the answer is most patients don't need everything. Often, small areas of improvement will make a big difference. And sometimes it just takes some injections with Botox or fillers. Other patients require more advanced surgery. It may be that your eyelids are looking a little bit old and we need to make them look younger. It could be that you need a little bit of a lift to your cheeks. Some patients do need everything, but they're not the majority of our patients. And so coming in and just finding out what would it take to help you look and feel as good as you feel today is very simple. We look forward to meeting you and talking with you about your difficulties.